Welcome with your favorite medical discussion, IMED. So IMED is a program where we consider certain medical concerns, diseases and giving you advices to lead a successful life with proper social, mental, physical and sometimes spiritual well-being to promote your health and live a successful life without any diseases, healthy and happily. So when it comes to small children, we consider a lot. Last week also we focused a certain disease condition and gave you certain advices to overcome such and how the treatments are. So today also we focus on small children and giving particular set of advices to a certain disease called urinary tract infections or rather UTIs, because people nowadays they know certain medical terminologies when it comes to investigations and medical reports. They can self-read some reports and just take an idea, so they are aware of certain terminologies, but although certain reports are precise and we can just get a certain idea, there are conditions we need some medical advice from experts, professionals in this regard. So when it comes to small children, making our own decisions as parents is not that much accurate, because when it comes to that type of a condition, we have to manage it properly and give the best outcome to our children and to lead them the rest of the life, to make them healthier more than that they were. So today we are going to discuss about UTIs or other urinary tract infections, and we invited Dr. Punyani Bandhutilaka, consultant pediatrician of the National Institute of Infectious Diseases. Thank you very much, madam, for joining with us. Right. So today we are going to focus about urinary tract infections. And madam, what causes urinary tract infections in children?
Okay. Actually, urine tract infection or urine infections you may have heard of, and this is very common among small kids and also among the elders as well. So what is the cause of urine tract infection? Actually, usually this is most of the time this is caused by a bacterial organism causing infection in your urine tract. So actually I have included a picture of a urine tract where you can have a good understanding about the urinary system. Where the picture it says there are two kidneys and then the ureters. So the kidney will produce your urine and the urine will come down the ureters and it will go to the bladder, and then it will be voided from the urethra when you really wanted to put it out. So that's how the urine is produced and voided from the body. So what causes UTI is this bacterial infections can invade the body and they can ascend through the urethra and go into this bladder and cause infection in the urine in the bladder. So which we call as lower UTI, or we call it cystitis, inflammation of the bladder. Right. But if this urine starts going, if the infection goes up the ureters and to the kidneys also, we call it pyelonephritis, where the infection will be much more severe. They will have high fever with chills and rigors, they will be very ill. So that is pyelonephritis or the upper UTI. Infection in the bladder is lower UTI. So all this is ascending infection from the urethra, and it is mostly it is a bacterial infection. And where is this bacteria coming from? Usually 60% of the time it is from usually from your own poo. The E. coli which is in your poo or the stools will be contaminated in the urinary tract, and the infection will ascend to your bladder and cause cystitis, or if it ascends further to your kidneys it will cause pyelonephritis. So,
Right.
2 types of UTI,
Right.
upper UTI and lower UTI.
Okay, so madam, with this picture that is being displayed on the screen, you might be clearly having a clear explanation and understanding about the 2 kidneys position and the 2 ureters, the 2 tubes coming to the bladder which temporarily stores urine, and the urethra which moves the particular stored urine out of the body. So that is the way, that is the order, as doctor specifically mentioned, how the urine comes down. And what infection does is it goes the other way, and the lower part or the upper part as well, with those 2 types of infection. So madam, if I may ask, we specifically described 2, the lower tract infections, urinary tract infections, and upper urinary tract infections. So those 2 conditions, anyways, the infection most probably, as you mentioned, it is bacterial infection. It comes to the urethra, that is the latter part, and first it might be a lower infection, and as time permits, and if it get worsened, it projects towards upper infection, or at the initial stage can it become an upper infection?
Yes, it can.
It can both ways. That means starting from a lower infection it can proceed, or instantly from the very first time it can be an upper infection as well. So madam, just a small thing that you mentioned, the bacteria is coming from our own feces, so defecating materials. The bacteria mentioned this Escherichia coli, the E. coli bacteria, which is like to be like somewhere around 4 to the count of 100 milliliters or something like that. Apart from that, it will be infectious. So in that condition, madam, how does it contaminate? Is it like when passing stools at the toilet and just not properly cleaning that particular anal area, or what are the possibilities of getting this contacted?
There are several risk factors for a child having urinary tract infection. Actually the most common thing is poor hygiene. So if the perineal area after defecation is not properly cleaned, they can get ascending infection. So especially in a girl, when you are changing the nappies or when you are changing the diapers, you have to wipe from front to back. And if you are cleaning also, you have to put water from the front and clean the back. Then you will not contaminate your urinary orifices and make the situation liable for a urine infection. So your proper hygiene is very important. Actually there are certain more things to this. The girl child is more prone to get urinary infection.
Yes, that's what I was to ask, with the structure.
The anatomy, because they are urinary orifice, and the orifice which is passed in the stools are very close to each other, and the girl's urethra is also very short. So they can get easily contaminated if you don't properly clean the child, and if you don't frequently change the nappies after each poo. So that is one thing. The other thing is, now kids like 3, 4, 5-year-old kids, when they start running around playing, they tend to hold the urine for a longer time. Sometimes the school children also, they go to the school and they come back and do a urination. They don't empty their bladder at school. So that is very bad. What we advise them is, you have to pass urine 2 to 3 hours. In 2 to 3 hours time, you have to empty your bladder. So if it is not happening, the urine is getting collected in the bladder for a long time, making them liable for UTI. So emptying the bladder quite frequently in 2 to 3 hours in small children is very important. Sometimes because of the unhygienic situations at school and all, children may hold till they come home to urinate, which is very bad. Sometimes the children are very playful and all, they will hold their urination and they will play around. So you have to remind small kids to put away in 2 to 3 hours time, and make it a habit for them to empty their bladder.
So apart from
girls are one thing, and the other thing is males. In male child, if they are not circumcised, that means the penis, the tip of the penis, the foreskin should be nicely retracted. If this foreskin cannot be nicely retracted and if it is very tight in the meatus, they are liable to get urine infections.
Right.
Because the bacteria can get collected there. So it is very important, if your child is having a very tight prepuce, seek medical advice. We can apply some steroid creams and make it into the proper position.
Right.
So it's a very easy thing to do, but you have to seek medical advice. If your boy child's foreskin of the penis cannot be retracted.
Retracted as in
Because
explaining
they
it more,
also-
madam,
yeah.
just moving to the down part of the, moving the, letting the topmost part open, like
Yes.
certain condition
So
might be
they
available.
will be more liable to get urine infections if the prepuce is tight. So one thing is that.
Right.
There are certain other situations where if your immunology system is poor, tending you to get more infections. If you are immunologically depressed also, you can get recurrent UTI. There are certain situations where you have some genetic abnormality in the renal tract. Because you have some genetic abnormality in your renal tract, the urine which is filled in the bladder can again go back. Usually it don't go back to the kidneys again from the ureters once it is filled in the bladder. Usually when the children are they produce urine in the kidney, it will come from the ureters to the bladder, then it will be voided out.
Right.
But in some children, due to some genetic abnormalities, this urine in the bladder can go back to the kidneys again, it will backflow.
Right.
In this situation, we call it vesico-ureteric reflux disease, which will predispose them to infection in the kidney or pyelonephritis, and it can cause scarring in the kidney as well, which will in later life they can go into chronic renal problems.
Right. Okay, madam, when it comes to certain medical reports of having calculi, that means simply we term it as stones in the bladder or ureter or kidney or any other location. In certain reports, might like our audience is also familiar with these terminologies, the doctors or the radiologist or the person who have done the report, they might be doing the comment, there's a certain back pressure being exerted. Is that also a cause for UTIs?
Not usually. Actually, small kids, usually they don't have much chance of getting urinary stones.
Right.
So there are possibilities, but it is rare.
Right.
And if they are having a stone, yes, the urine can get stagnated and they can predispose to UTI.
Right. So, madam, you explained a series of factors.
There are certain more things.
Yes.
Actually.
Can we just explain that means
one more common thing is constipation.
Uh-huh.
If your child is not opening bowel regularly, daily, soft feces, sometimes children may not pass stools for 3, 4, 5 days, and the poo can get collected in your rectum, and slowly they can leak a little bit without the child's knowledge.
Right.
And they can get contaminated and it will invade the urine tract, and they are also liable to get urine tract infection. So constipation is a very bad thing with regard to getting UTI. So you have to be very careful for your child not to get constipated.
Right.
So that is also one thing. So we will advise them to get lot of water to drink, lot of fiber diet like green leaves, vegetables, fruits in their daily meals, each meal, to include in each meal, to prevent them from getting constipation apart from getting lot of liquids.
Right. Okay. So, anyways, drinking water is good for the urinary system, the renal system, and but constipation, yes, that is also a condition that you should consider. And if you have if your child is suffering from constipation, you have to give exercise care about those things. Why? Because as the doctor mentioned, there might be certain possibilities that they can occur. Madam, are they the only risk factors?
And also some kids with neurological problems like back problems, where they have weak nerves going into the lower limbs, and sphincters can be weak, and those kids also can get urinary tract infection. So there are children rarely who have neurological problems, weak nerves, where their legs are not working, those kids also can get urinary tract infection.
Right. Madam, what you have mentioned in this explanation is when it comes to these risk factors of urinary tract infections, it's like the contamination of feces with this bacteria and moving it to the urinary system, or even it from our own urine being back
Own
pressure
feces.
on feces moving into this urinary system, those types of conditions. Apart from that condition, and is there any possibility of germs can enter this system?
Yes, sometimes the child can get septicemia, and from the blood also the system can get infected. So where we can't find a port of entry, but they will get UTI, and also the it will spread into the blood, and they will get septicemia, and they will be like really toxic, ill, febrile.
Right. So, madam, hygiene, you specifically mentioned one thing, we should maintain our hygiene properly. So, changing undergarments, and how does it affect this thing?
Yes, actually we will advise the kids, especially during the small age, they should wear cotton undergarment, because they otherwise the sweat can collect, and it can also predispose to getting infections, not specifically maybe UTI, but intercrural between the legs and all, they can get infections, especially fungal infections and all. So it's always better for your child to have cotton undergarments, so it's hygienic.
Right. Okay. So, madam, I need a short answer for this question. Some disease conditions are there which have no symptoms. Is urinary tract infections have symptoms?
Yes.
Right. Can we just explain those things, madam?
Yes, actually children, we will, if we divide children into two groups, the bigger children like more than 2 years of age, they will complain to you that you are when you are passing urine, it will be burning, paining in their urine, and they will be having frequency where they will pass small amounts of urine very frequently, and urgency, they wanted to all the time, they wanted to go to the toilet to pass urine. So that is one group where they will have infection of the lower UTI, and some may send the infection to the kidney also, and they will be having high fever, temperature more than about 39 degrees Celsius, or about, if you say in Fahrenheit, more than 102 degrees Fahrenheit temperature, very ill, toxic. They can have fever with chills, they may be shivering, and also they will have back pain, tummy pain, flank pain also, and also they will have vomiting. They will have nausea, vomiting, and they will have poor feeding. So that may be the bigger children. But small kids, the kids from birth up to 1 year, they may not be able to complain their urine is burning, but they may be crying while passing urine, or fever may be the only symptom that we find. From time to time the child is getting fever for no reason, no cough, no cold, no diarrhea, no vomiting, but just having on and off fever. So if the child, your child is getting fever on and off for a long time, yes, we have to find out whether the child's urine is infected. So that is one group. The other small age, below 1 year children, sometimes they may be ill, clingy, crying, or they may be very lethargic, poor feeding. Sometimes some children come to us and they are for the weight measurement every month. They will come with the weight chart to measure their weight, and always the weight is the same. It won't go up, but the weight is flattened. To find out, this is because of a UTI. So there are so many ways the child can present to us with a UTI. So it can be with just only fever going on for some time or on and off, or they may be come to you with poor weight gain, or they may be coming with symptoms like fever with chills and rigors and those things, or urinary symptoms like burning and those things.
Right. So, madam, what you specifically mentioned there, when it comes to smaller children, less than the age of 2 years, they have no any understanding how to express the burning sensation and everything. So, in that case, what they express is through crying while urinating. So, parents must consider, yes, crying for everything. Yes, that is their mode of communication. So, you must be aware about what situation, what is the moment that the child is crying. Am I correct, madam?
Yes.
Is when it is urinating, it might be a burning sensation of the urine. So it might be like certain discomfort of other end, like my breastfeeding or whatever it is. It tend to give us certain signals in certain conditions. So madam, in our certain disease conditions, we just explain a particular time period. At the last week, what we were discussing about this febrile fits, just 6 months to 6 years. Likewise, what sort of an age is more prone, or what is the age that UTI can get caught to a child?
Yeah, actually within the first 1 year, it's very common. I would say if the child is present to you with fever, about 10% of them can have UTI. But when the child is getting older, it is much less. But it is very difficult to say. It's irrespective of your age. At any age you can get a urine tract infection. Some children during their teenage days, if they are sexually active or newly married ones, or those ones also, because of sexual activities also they can get UTI. So likewise at any age, even old age, because their sphincters are not competent enough, so they can leak a little bit of feces and get contaminated. So even during the old age also, they tend to get more urinary tract infections. So at any age you can get UTI.
Right. So apart from these small children, you got some advices ranging the span of years and how urinary tract infections get caught. So it's like any age there might be certain possibilities that you can get infected with urinary tract infections. But when it comes to small children, you have to consider, as the doctor said, less than 1 year might be more prone, because like they are not aware about their hygiene. They just have their own movements and certain other conditions that they even can't manage their own. So we have to consider and we have to give due care to them. So madam, you see, if this is a more prone disease and more commonly occurring, and even 10% of the cases or rather more, and even small children are more commonly coming out of with these urinary tract infections, are there any consequences afterwards, or that's it, or what is the relationship?
In some kids there can be consequences. So once they are diagnosed with UTI, actually we will screen them for any long-term complications.
Right.
So how to diagnose this?
Yes, that's what. We'll move on with that, madam.
So if the child comes to us with alarm signals or alarm signs of which suggest a urine tract infection, first we will get a good history and see whether there are any predisposing factors and things for UTI. Then we will do a good examination to see whether there are any. If it is a girl child, we will see the perineum for their hygiene and labial additions and things. And if it is a boy, we will retract the prepuce and see whether there is a tight prepuce, and look into the tummy, their hydration level, if they are vomiting and all. So we will do a good examination, and then we have to establish a diagnosis. So it is very important that we do a urine full report and a culture to come to a diagnosis. So it is very important to get a clean catch midstream urine sample and send it for urine full report and culture. So when you send it, the UFR will come quite soon, and it will give us signs like urine will contain pus cells, nitrites, esterases, leukocyte esterase, and all those things which will predict there is a possibility of a UTI. But to confirm the diagnosis, we have to have a urine culture report, which will take about 48 to 72 hours to get the report. But it will say a specific organism will be grown for more than 10 to the power 5 for us to say it's a UTI.
Right.
So urine culture report is very essential. But once you send the urine culture report to the lab, we can start treatment if the child is ill and not well.
Right. So ma'am, I'll be developing a small case like this. A small child is complaining with those certain sort of what do you call, it's like, we'll conclude it as a child more than 2 years, with burning sensation when urinating, and certain similar conditions that might be fever. So parents might be a person who is watching this program, right? Okay, so then let's take a urine full report and go to the doctor. Is it a good practice?
I think both way it can be done. You can collect a good, the urine sample should be collected ideally very clean catch. So if you are very quite competent to do that, if you have done it before, you can even get the urine report and go. Otherwise you can go to the doctor, get the child get examined by the doctor, and he will prescribe for the urine culture report.
Right.
So whatever it is, if you are collecting a urine sample, you should know how to collect a very good urine sample.
Shall we just explain clearly, madam, how to get a good catch of urine sample?
Actually, we will be giving you a good sterile bottle to collect the urine. So this bottle should not be washed. So we should collect the urine only to the bottle. You can't collect it to somewhere else and put into the bottle. So what we will do is, we will clean the perineum with baby soap and water, and then when the child starts urinating, we will allow the first few drops outside, and then we will put the middle of the urine flow only to the bottle itself, close the cap tightly, and give it to the lab immediately.
Right. What is the volume, madam? It's adequately.
It is not. It is immaterial actually. If you can collect a reasonable sample, that is enough. Few drops will not be enough, but if you can collect a decent sample, that is enough. But how you collect it, how you clean it are the really important things. And if you are getting delayed to give it to the lab, you should put some ice in a bag and put the sample in the ice bag and take it to the lab.
Until that happens, refrigerating is okay?
Refrigerating is all
right. Okay, madam, some practical problems encountering because this clean catch sample of urine is what matters with the diagnosis. When the sample has been collected, sometimes people might use the first stream of urine. You mentioned the midstream. Why first stream is not used?
Because the first few drops can be contaminated with the skin itself. So we will allow it to go out, and then we will collect the midstream.
Then the latter part, the in-stream?
It's all right.
It's all right. So from the midstream onwards, that is good to collect.
We can collect it.
Right.
And the other thing is, immediately once you collect it, you have to hand it to the lab.
Right. Okay. So madam, with the first instance, normally like people carry only one bottle of that thing to collect the urine. They don't have 2, 3 more. Sometimes they might have, but we are not opening and keeping it. It's packed, and we should open the seal pack when just they want to collect the sample. Then, madam, the first instance, due to some issues or whatever, the what do you call, the top of this cap might be like touching, like closely dealing with the organs of the internal.
Usually we ask them not to touch the
right
surrounding of the body with the container and very carefully collect it.
Right.
And the other thing is very small kids, like very small ones. If you can't collect a proper midstream sample, there are other ways, like we can introduce a small catheter or a feeding tube and get a clean cat sample.
Can that be done at home, madam?
At hospital.
At hospital.
At hospital.
Right. Okay. Don't try at home.
Yes,
right.
With a very trained person. Or else we can put a small syringe to the bladder and aspirate some urine as well.
Right.
So those possibilities are there at hospital.
At hospitals, specifically mentioning those at hospitals. Right. Okay. So, madam, one more question. So, when the urine sample is been collected, at one instance, so the child suddenly stops urinating and no adequate volume of urine is collected.
Yeah.
Can just tightly be closed or kept in there? Just can monitor for the second time and collect?
No.
No.
Usually you can send the first sample to the lab. So if they can proceed with that, it's all right. Then we can give another bottle to collect another sample. After giving adequate fluids to the child, we can collect another sample.
Right, not mixing the sample. So why, madam, is it like the matter of
there
contamination?
There are possibilities of contamination if you reopen and keep it, so we won't do that.
And we should bring it closely as soon as possible to the nearest laboratory or the hospital, the place that you got the bottle, to further investigations. Madam, some people like they just request in certain conditions because due to this economic impact and other conditions, investigations might be like to a certain cost they have to afford. So in when it comes to certain investigations, so doctors always prescribe the basic investigations and try to initiate treatments depending on that, not letting people in burden to get more and more investigations. But in this scenario what we have discussed, the urine full report and the culture, they are essential for treatments.
They are really essential to specially treat the child with UTI, because we have to confirm that this is a urine tract infection by the culture report.
Right.
If you are confirmed that your child is having a urine tract infection by a proper culture report, then only we will be investigating them further to see whether this child's urinary tract infection has caused any damage to the kidney. So for further investigations, this is really essential, because those further investigations are really costly.
Right.
So before putting them on that burden,
at least
we have to find out a proper urine culture, positive culture report.
Right. If one may suggest that certain extreme conditions, doctor, can we please start medication from this UFR later on? If this is not healing, shall we go with the culture? What is your advice, madam?
No. Once we give antibiotics, we can't do a urine culture. So before starting the antibiotics only, we have to take the culture. So if there are economical problems, best thing is for you all to come to the hospital, that we can do urine full report, culture or any other test free of charge.
Right. Okay. So these investigations are mandatory, because in certain cases, for certain diseases, right? Okay. So doctors might prescribe this test is okay. This is the first thing that you have to do. Then these things are not that much essential, but let's check and move to the second stage. But for this urinary tract infections, doctors they will give the exact advice to you. Just we need both these. Why? Because you might be familiar with some words to prevent further investigations which will execute a high cost. So madam, what are the investigations that they need to proceed afterwards if they are not performing this thing very well?
Actually, if we diagnose urine tract infection by a properly taken midstream sample being positive, usually we will treat these children for 7 days with antibiotics. If the kid is not very ill, but they have burning pain and all, if it is a low UTI, we can give oral antibiotics. But we will give regular antibiotics for 7 days and we will finish the full course. But if the child is very ill looking or if there is evidence of pyelonephritis, we will go for antibiotics from the vein. So we will admit them and we will give the antibiotics via the vein, and then once they settle, we may be able to send them home with oral antibiotics. And at the meantime, if they are vomiting and if they are dehydrated, we have to look into their hydration as well. So we might have to give some saline drips and maybe Jeevani to drink and all those things, and correct their hydration. If their electrolytes are not all right, we have to correct their electrolytes. If their sugar levels are not all right, we have to correct their sugars, and all those things can be done once they come to the hospital.
Right.
So anyhow, these antibiotics will be going on for 1 week to properly treat. Otherwise they will be partially treated,
Right.
and they might get it again. So we will give the full course of antibiotics, and after that we will go to proceed with the further investigation. So all the children who have had a UTI, we will be doing a scan of their kidney, ureter and bladder to find out whether they have any underlying structural renal or bladder, urethra problems in this child.
Right. So it's very clear that doctor specifically mentioned that we have to complete the full course of antibiotics. No halfway treatments, no partial treatments. Why? Because it will tend to come again, and certain types of drug resistivity, and there might be certain consequences for you all without taking the medical advice, because like the first few days of having antibiotics, you will be okay with the symptoms and they try to stop. That is not advised.
Usually most of the mothers, they will stop when the child's fever settles with the antibiotic. They will give for 3-4 days and then again they will stop. But in a urine infection, this should not be done, because it can cause infection in the kidney and scarring in the kidney, and later they can go into chronic renal disease, blood pressure, hypertension and those things. So you have to be very careful with the kidney infection.
Right. Madam, you mentioned about Jeevani and certain types of solutions. So oral hydrating solution, rehydrating solutions, ORS. So those types of rehydrating solutions, can they take at home as home remedies? Is it okay?
Definitely they can take. If the child is not taking enough drinks and if the child is vomiting, we will ask them to give small amounts of Jeevani very frequently, like from a spoon. We will ask, but if you give a big amount of Jeevani from the cup, they might vomit again. But if you give small amounts frequently from a spoon, they will tolerate. So Jeevani can be prepared at home. There are packs which should be dissolved in 1 liter of water. So you have to use boiled cooled water and dissolve it and give it.
Right. Madam, how to prevent these urinary tract infections?
Yes, it is very important that we know how to prevent urine infections. So proper hygiene is the key to most of the things. So proper hygiene is very important, especially when you are changing the nappies and when you are changing the diapers. You have to clean the perineal area from front to the back. When you are cleaning the when you have defecated and cleaning, also put the water from the front and clean the back of the baby girl usually. And so the perineal hygiene is very important. And then the child can get urine tract infection if they are getting constipated. So it is very important that you should prevent constipation. So take lot of water and drinks and liquids to prevent constipation, and also include lot of green leaves, malung, vegetables, fruits in your child's meals, and especially for adults also it is the same, and prevent constipation so that there are less chances for you to get urine infections. And children who have had a UTI, you have to be very careful, and if they have any structural problems and all, and if we prescribe any drugs to take, you have to properly take the drugs. You have to properly go for the clinic visits and follow up with the physician as appropriately. So those things are really important when it comes to UTI prevention.
Right. So, madam, finally, and can we just give some are there any important things that parents have to consider apart from those?
Actually, what is really important to know is that UTI is not contagious. So, your child won't get a UTI if she or he shares the same bath with another child. Like when you are swimming in the same pool, you don't get a UTI. And it won't be, your child won't get a UTI because they are seated on a contaminated toilet seat. They won't get it. So those things are good things. So, but your perineal hygiene is very important.
Right. Okay. So we discussed some important areas and important disciplines with regard to urinary tract infections. So when it comes to small children, we have to exercise due care because they are not properly aware. But when it comes to less than 2 years, you have to exercise some more care, additional care to prevent the certain consequences of these effects. So thank you very much, Dr. Punyani Bandutilaka, consultant pediatrician of the National Institute of Infectious Diseases. Thank you very much, madam, for joining with us with our discussion. So ladies and gentlemen, the IMED program specifically focusing on special types of diseases. Today also we consider pediatrics, considering small children, urinary tract infections, which is one of the vital areas that you all have to have a certain understanding when it comes to certain disease conditions and home remedies for certain management options. So at the end of today's IMED also will be giving you some nutritional tips. Small video clip is prepared. So with that video clip, we are going to wind up today's program. Do watch us the rest of the programs and stay tuned with IMED future programs.